Waking up and realizing that your morning erection has disappeared may seem unimportant at first. However, this can be a sign that something is not functioning properly in the body. The body communicates, and when it stops responding as it used to, it's crucial to pay attention. This change may be related to blood circulation hormone levels or even lifestyle. Many men ignore the first signs, believing it's just a passing phase. But when this becomes frequent, it's a warning sign for health. The positive side is that in most cases, there are effective ways to restore vitality and bring back morning erections. I'm Eva Torres, a urologist, and in this video, I will explain why this happens, the factors involved and what can be done to reverse this condition. The sooner you understand the causes, the faster you can take action to restore your body's balance. Before continuing, check if you are already subscribed to the channel to stay updated on more content about health and sexual education. If this video was useful for you, like it so that more people can access this information. I want to hear your opinion in the comments. Type 1 if you found the topic relevant, or 0 if you have suggestions to improve the content. Your participation makes a real difference during the night. While the body rests, the brain remains active, regulating several essential functions, including the production of hormones that directly influence blood circulation. The morning erection is a YRA reflection of this, a sign that the vascular and neurological systems are working well. This phenomenon occurs due to an increase in nitric oxide secretion, a substance that dilates blood vessels and allows the penis to fill with blood, resulting in an erection. The main factor responsible for this process is a sleep phase called REM, rapid eye movement, which happens multiple times throughout the night. It is during this stage of rest that the body reaches peak testosterone production, a crucial hormone for libido and sexual health. Additionally, the brain reduces levels of norepinephrine, a neurotransmitter that, when present in excess, can inhibit erections. Many people believe that morning erections happen due to the need to urinate. But this is a myth. If that were true, simply drinking a lot of water before bed would guarantee waking up with an erection, which clearly does not happen. The fact is that morning erections are a natural indicator of male health. When they start to disappear without an apparent reason, it may be a sign that something is not right in the body. Do you want to improve your sex life and strengthen your relationship in the digital book, Rediscovering Intimacy, Help Healthy Sexuality After 60, you'll find practical tips to reignite desire, overcome physical and emotional challenges, and enjoy more fulfilling moments. Access it through the link in the first pinned comment and discover how to transform your love life. The disappearance of morning erections can be just a natural variation of the body or a warning sign for more serious issues. It is common for the frequency of these erections to decrease with age, but that does not mean they should disappear completely. If morning erections were once part of your routine and are now increasingly rare or non-existent, it's worth paying attention. One of the first points to consider is the impact of stress and accumulated fatigue when the mind is overloaded. The body responds by reducing functions that are not essential for immediate survival, and sexual function is often one of the first to be affected. Poor sleep, excessive worries, and a draining routine may be behind the absence of this natural bodily response. Additionally, cardiovascular health plays a crucial role. Erections depend on efficient blood circulation, and any alteration in the blood vessels can affect this process. High blood pressure, high cholesterol, and diabetes are conditions that reduce blood flow, directly impacting erection. The disappearance of morning erections may be an early sign that the vascular system is not functioning properly, requiring medical attention. If this happens occasionally, it may not be a cause for concern, but when it becomes a regular issue, it's worth investigating. The absence of morning erections can be one of the first signs that something is not right. With overall health, testosterone is one of the most important hormones, for male health directly influencing libido energy. And of course, erectile function. During the night, testosterone levels reach their peak, helping to stimulate involuntary erections that occur during REM sleep. When testosterone levels are low, morning erections can become less frequent or even disappear completely. Several factors can lead to a drop in testosterone, and age is one of the main ones. After the age of 40, testosterone levels gradually decline as part of the natural aging process. However, this decline can be accelerated by harmful habits such as a sedentary lifestyle, a diet high in sugar and unhealthy fats, excessive alcohol consumption, and sleep deprivation. Additionally, constant stress releases cortisol, a hormone that competes with testosterone and can reduce its production. Another important factor is hypogonadism, a condition where the body does not produce enough testosterone. This can occur due to issues with the testicles or the pituitary gland, which controls hormone production. If the lack of morning erections is accompanied by extreme fatigue, muscle loss, and decreased libido, it may be a sign that hormone levels need to be evaluated. Medical monitoring and lifestyle changes can help restore normal levels and improve erectile function. Erections are directly dependent on blood circulation. When blood flow encounters obstacles such as hardened or narrowed arteries, the result can be the loss of morning erections and difficulties in other situations. This happens because the penis needs an adequate blood supply to achieve and maintain a firm erection. If this mechanism starts to fail, it can be an early warning sign of cardiovascular issues. High blood pressure, high cholesterol, and diabetes are some of the conditions that compromise vascular health. High blood pressure, for example, forces blood vessels to work under great tension, making them less flexible and reducing their ability to dilate, which is necessary for erections. Excess cholesterol, in turn, leads to the formation of fatty plaques in the arteries, restricting blood flow. Meanwhile, uncontrolled diabetes damages nerves and blood vessels, impairing erectile response. Another concerning factor is a sedentary lifestyle, which reduces circulation efficiency and promotes fat accumulation in blood vessel. Regular exercise improves circulation and helps maintain a healthy cardiovascular system. Therefore, if morning erections disappear persistently, it could be a sign that the heart and blood vessels need attention. Adjustments in diet, managing chronic diseases, and incorporating physical activity can reverse this condition and restore male vitality. Sleep plays a fundamental role in hormonal regulation and body recovery. During the deepest phases of rest, the body carries out cellular repairs, strengthens the immune system, and regulates the production of essential hormones, including testosterone when sleep is interrupted or insufficient. These functions are impaired, directly affecting the quality of erections. Sleep deprivation can reduce testosterone levels by up to 15% in just a few days, impacting not only libido, but also the ability to maintain a firm erection. Additionally, the body releases more cortisol, the stress hormone which inhibits the production of nitric oxide, essential for blood vessel dilation. The result: less frequent and weaker erections. Another critical point is the quality of REM sleep, the phase in which involuntary erections occur. People who suffer from insomnia, sleep apnea, or who sleep only a few hours per night may not reach this phase, regularly compromising erectile function. Additionally, working night shifts or maintaining irregular sleep habits can disrupt the circadian rhythm, interfering with hormonal peaks. Maintaining a dark environment, avoiding screens before bedtime, and keeping a regular sleep schedule are simple measures that make a big difference. Improving sleep quality not only supports ending erections, but also benefits overall health, providing more energy and hormonal balance. The human body responds automatically to stress by releasing hormones such as cortisol and adrenaline. These hormones are useful in dangerous situations, but when they remain elevated for long periods, they start to have negative effects on the body. One of the first impacts is on the cardiovascular system, impairing blood circulation and consequently erection quality. The penis needs efficient blood flow for an erection to occur, and excessive stress can make this process more difficult. Additionally, constant anxiety keeps the brain in a state of alert, reducing the production of nitric oxide, a substance essential for blood vessel dilation. This means that even in moments of rest, the body remains tense, making it harder for the natural physiological response to arousal and reducing the frequency of morning erection. Another important factor is the impact of anxiety on sleep. People who experience intense stress often have trouble relaxing and entering the deepest phases of rest. This directly affects hormone production and may contribute to a decrease in testosterone, further worsening the situation. Managing stress and anxiety is essential for sexual health breathing techniques. Physical activities and leisure moments help reduce cortisol levels and improve erectile function. Small lifestyle adjustments can make a big difference in restoring morning erections and overall quality of life. The body directly responds to daily habits, and some choices can harm morning erections without a person realizing it. Sedentary behavior, for example, is one of the biggest culprits. Lack of physical activity reduces blood circulation, promotes fat accumulation, and impairs nitric oxide production, an essential substance for blood vessel dilation. Without proper blood flow, erections become less frequent and weaker. Another harmful habit is an unbalanced diet. Excessive consumption of sugar and unhealthy fats contributes to high cholesterol and insulin resistance factors that compromise blood vessel health over time. This can lead to circulatory problems, making it harder for blood to reach the penis. Excessive alcohol consumption also deserves attention. While small amounts may benefit circulation, frequent consumption affects the nervous system and lowers testosterone production, directly impacting erectile function. Smoking is another critical factor. Nicotine narrows blood vessels, making it harder for tissues to receive oxygen and reducing the ability to achieve a firm erection. Additionally, lack of sleep, a stressful routine, and sitting all day negatively impact erectile function. Simple changes, such as incorporating daily walks, improving diet, and reducing the intake of harmful substances, can make a significant difference in restoring morning erections and overall health. In most cases, it is possible to regain morning erections by making lifestyle changes. Small adjustments in daily routines can lead to significant improvements in sexual health and overall well-being. The first step is to take care of blood circulation. Regular physical activity such as walking, weight training, or even daily stretching improves blood flow and stimulates nitric oxide production, which is essential for blood vessel dilation. Diet also has a direct impact, including antioxidant-rich foods such as berries, leafy greens, and healthy fats from olive oil. An avocado helps protect blood vessels. Additionally, reducing sugar-fried foods and excessive alcohol consumption prevents inflammation and improves testosterone production. Quality sleep must be a priority, creating a consistent sleep schedule, avoiding bright screens before bed, and ensuring a dark and quiet environment contribute to deep and restorative rest. Stress management is also crucial. Relaxation techniques such as deep breathing and meditation help lower cortisol levels and maintain hormonal balance. Small daily adjustments can make all the difference in restoring erectile function and improving male vitality. If morning erections have become less frequent, this could be an important warning sign about your health. As we've seen, factors such as blood circulation, hormone levels, sleep quality, and even stress can interfere with this process. The body always gives signals, and understanding them is essential to take action before problems worsen. Small lifestyle changes can make a huge difference. Improving your diet, staying active, getting quality sleep, and reducing stress are fundamental steps to restoring vitality and erectile function. Identifying the root cause of the issue is the first step toward the solution. And in your case, how is your sleep quality? Do you wake up feeling rested, or do you struggle to get a good night's sleep? Share your experience in the comments if this video helped you. Like it now, your support is essential for more men to access this information and better understand their bodies on this channel. You'll find other videos that dive deeper into this topic, offering practical tips to improve circulation, regulate hormones, and restore male energy. Watch them next and keep learning if you're not subscribed. Yet, take a moment to do so now and stay updated on more content about men's health and well-being. What